Welcome, this is Dr. Bertalan Mesko, the medical futurist. It's such a pleasure for me to take part in this quite huge event organized by the Brazilian Association of Drugstores. I know that many of you are pharma executives, many of you own drugstores and retail centers. So my job for today, at least that's the plan I have in mind, is to give you a picture about where healthcare is heading in the 21st century, how the use of advanced technologies might impact the near future of pharma and pharmacies, how COVID-19 has impacted all that, and even how technology giants like big tech companies from Google, Apple to Microsoft might impact all these changes before. Yes, all these in 28 minutes. So let's jump right into that. I think when we try to better understand the near future of pharma and pharmacies, then we essentially forecast the near future. And what's better for forecasting than watching and reading science fiction? When you watch and read science fiction movies and books, you get inspired by the possibilities of what kind of things technologies can bring into our lives and jobs. It happened to me too. I was a 6-year-old kid when I got a book from my mother about the scientific method, and there I fell in love with it. I knew I would dedicate my life to doing research in life sciences, and that time I was inspired by some pretty good science fiction movies. I'm sure you've seen many of these. So I was certain that by the time I would go to medical school, I could start working with these technologies. But in fact, that was not the case. However, a few years ago, I came across a head-mounted device. I could just put it on, click on start, and there it happened. A 3-dimensional holographic body appeared in front of me. It had a beating heart. I could dissect it without limitations, even the formaldehyde smell. And there I was, that 6-year-old kid again, meeting science fiction. That's the feeling you have to get prepared for, meeting science fiction. Feeling the technological sublime that things can get so much better by using advanced technologies. The lives of patients, the jobs of medical professionals, those working for patients in pharma and pharmacies. We could do our job better because we can reach out to advanced technologies. But the job that we do at the Medical Futurist Institute is that we are trying to find out, well, why don't we see these science fiction-like technologies in healthcare today? Because that's the point of care you all know. No matter which country you live in, what language you speak, this is the point of care where you have to go for medical help. But it's not like transportation where we are planning to go to Mars, or the energy sector. All these sectors have really amazing innovations coming out day by day. But in healthcare, it just doesn't feel like science fiction. No patient ever said that. I just came out of this pharmacy and it felt like science fiction. But why not? Let's see why. The first reason for not seeing science fiction essentially in healthcare is that the system was never designed to be that open to innovations. There are some sub-reasons, explanations for that. We live in an era with doctor shortages. 5 million healthcare workers are missing, so you and I, we will always live in a world with doctor shortages. Plus, 1/3 of patients turn away from us because they don't have enough time with physicians, they can't build enough trust. Therefore, they turn to alternative therapies. One more sub-reason. There's a financial issue. If you live in a country with socialized medicine like I do, you get access to care, but there is not much money left for innovations. If you live in a country with a private insurance system, you can get all the innovations you want if you are wealthy enough. You see, that's not fair. It means if I can afford a 3D printed medication or a 3D bioprinted human tissue and you cannot, I can live longer. That's an ethically nightmarish scenario, so let's not do that. But for these sub-reasons, healthcare was never been designed to be that open to innovations. Even if it could be more open to innovations, then comes the second reason for not seeing science fiction in healthcare. And I'm sorry, that's you and I. We people working for healthcare, we are very slow at adopting changes. I mean, eventually we do, but it takes a lot of time. Just look at the stethoscope story. 200 years ago, that's how we listened to the cardiac and lung sounds of patients, by putting our ears to the back or chest of patients. Then the French physician Laennec came up with this brilliant gadget idea, the hollow wooden tube that would augment that sound. Physicians didn't want to accept that. Even 30 years later, many physicians said that they didn't want to use a gadget while practicing the art of medicine. In fact, today, if this thing is around your neck, you must be a healthcare professional. It has become the symbol of being a physician. The point I'm trying to make now is that before we had 30 years to adopt one medical innovation, and now there are 30 medical innovations, if not 300, coming out every single day. And it's really hard to adopt all these changes when you're pressurized to change, but naturally, that's how we work as social beings. We cannot change that fast. But that creates a pressurized gap between what could be possible and what we have today. Even if you could be a bit faster at adopting these changes, then comes the third reason for not seeing science fiction in care today. And that's it's easy to be afraid of the unknown. And by the unknown, I mean the biggest force, the biggest change, the biggest shaping thing coming to healthcare or pharma, artificial intelligence, automation in general. Just look at what has happened to chess. In the 1990s, the best chess player, Garry Kasparov, was beaten by a supercomputer, not even an artificial intelligence entity yet, just a huge computer. And there were people saying at the time that that's the end of chess. Who would play chess ever again when the best player is an algorithm? Well, today more than 600 million people play chess every day, me included. I hope many of you play chess too. All the chess players, literally every single chess player, must work with AI. Every chess coach uses AI to better prepare their players. And even players like me who just watch tournaments live, we need the evaluation of AI to understand what might be going on in the minds of grandmasters. So chess has become much better because of AI, even though the best chess player today is indeed not Magnus Carlsen world number one, but an algorithm called AlphaZero Lila. And there is a huge difference even between Magnus Carlsen and AlphaZero Lila. It's an alien level, the kind of playing level that the algorithm can produce. That has happened, but chess is better. I think the same fate awaits pharma and healthcare. We will not be able to use to provide care, to provide medications, to run pharmacies without using artificial narrow intelligence. I think this idea is being underscored when you look at games that require even more intuition and creativity, like the Chinese board game called Go. And when the best Go player was beaten by an algorithm, we knew that change was about to happen. So I think at this point, we must say out loud that there are cognitive tasks where we cannot and maybe shouldn't compete with artificial intelligence. We have to find the areas where our human expertise is needed, where we can work with empathy, compassion, creativity, things that are very hard to be mimicked through algorithms. But when it comes to a data-based, repetitive task of our jobs, I think that should be automated, leaving us with more time to spend on things that really require our human brain and vision and expertise. So summing all these up, why we don't see science fiction in healthcare, I think now we can fairly confidently say that what healthcare has been going through in the 21st century is not a technological revolution, it's a cultural transformation. Of course, it was initiated by technologies, but it's driven by cultural changes. The way the hierarchy between the physicians and patients has been transforming into an equal level partnership, or how the roles of physicians and patients have been changing, these are much more fundamental than which gadget or artificial intelligence-based medical device can come out next year. So a cultural transformation is going on, and that's what we call digital health. Digital health is a range of technologies, a cultural transformation that provide data for both patients and physicians, leading to an equal level partnership, and on the long term, the democratization of care. But if I had to summarize all these changes in one final sentence, I would say that digital health makes patients the point of care. Out of this, patients will become the point of care themselves. They will receive diagnostics, treatments, monitoring wherever they are because they have access to advanced technologies. You know, this trend has been going on even before the pandemic, but because COVID-19, something huge just changed. The technological adoption that was lagging behind took place in the span of months and weeks in 2020. While telemedicine had been in the news for more than a decade, but none of the countries could really use or exploit telemedicine. Now, last March and April, many countries started implementing telemedicine because there was no other way of providing or receiving care. They had to reach out to telemedical companies, telemedical platforms and devices, making sure that patients and physicians can still build a relationship based on trust through these telemedical services. So while the technological adoption took place quite fast because of the pandemic, the cultural transformation is still lagging behind. We have to help healthcare professionals, pharma professionals, and even patients better understand what they can expect from using these technologies, how they can build real-life relationships while using these technologies. And one more thing here, another huge change in the business of pharma and pharmacies. Technology giants. Companies like Amazon, Walmart, Google, Alphabet, they want to have a piece of the cake in the healthcare ecosystem. And many of them, like Amazon and Walmart, have been launching their own drugstores. So tech giants want to get into your business. They are not good at your business. You have the expertise and the experience, but they are very good at something people need these days. Developing technologies and devices people want to use. I'm not saying that you should compete with them. I'm saying that you should collaborate with them, finding out how you collaboratively could use your expertise and experience with the technological products they can make that, again, people want to use. But for all these reasons, I think it's time to look through a few approaches, a few points that might better help us prepare for the near future. This is sort of a guide about being able to do that. So, by acknowledging that a cultural transformation has been going on in healthcare, by acknowledging that COVID-19 has led to a fast technological but not cultural adoption of these technologies, by acknowledging that tech giants want a piece of your business and you should collaborate with them, I think it's time to summarize everything up, make sure that I just come up with 3 points or approaches that might help you better prepare for this near future of pharma and healthcare. This is the picture I always have in mind about patients from the near future, that they can have monitoring, they can do disease and health management wherever they are, maybe at home, maybe on the way to the medical practices or at the traditional point of care. But healthcare is centered around them and not patients are centered around healthcare systems. I think this idea is going to be quite useful when I will discuss what kind of future scenarios we came up with when discussing the future of pharmacies. So let's see these 3 major points that might help us get a better picture about the near future of pharmacies and healthcare. The first point, I think that's my most important point. It might sound weird, but you must embrace patient design. That's not the same as patient centricity. Being patient centric is of course very important, but that's not enough anymore. Patient design means that you involve patients on the highest level of decision making in your company or organization. In practice, you don't design a new part of the building at your pharmacy without involving patients in the decision making. You don't develop pharma products, drugs, medical devices without involving patients on the highest level of decision making. Let me show you how it works in action. I was invited by a Dutch professor to give me an example about what patient design means in action. He told me that they wanted to design a new facility for the hospital and they invited their chronic patients to have their voices heard before the first design plans were ready. That's what you have to do when you embrace patient design. I was told that patients ask for round tables, not the traditional work desks where physicians can access all the information and monitors, but patients cannot see anything. No, a round table where as equal partners, they can discuss health and disease management. They wanted to have a designated area within the room called the clinic, where a physician could professionally examine a patient. So I had to ask them about, well, how do patients feel about this new space? They told me that patient satisfaction is skyrocketing because patients who are in these rooms feel like they are valued members of the medical team. They are very much engaged with their health and disease management. Physicians love this space because for them, it's easier to work with empowered patients. Even based on studies, we know that it means less time, less stress, better questions, higher compliance while working with such patients. And as a good European, I had to ask about the cost, and I was told that there was an IKEA table and blue duct tape on the floor. So patient design is not about money. It's about the idea that how can I think that I can develop anything for patients without actively involving them in the process. So what we do now at the Medical Futurist Institute is that we try to convince healthcare organizations, pharma companies, pharmacy owners to implement patient design, to involve patients on the highest level of decision making within their organization. Point number one. Point number two is about understanding how good technologies can augment what you have been doing in your job. I discussed before that the roles of physicians and patients have been changing. The role of the physician used to be being a key holder to the ivory tower of medicine. But in the 21st century, something changed. All the patients immediately started getting access to data information. So there was no ivory tower anymore. And now the role of physicians is to be a guide for their patients in the jungle of health information. The passive role of being a patient, waiting for a symptom to appear and only then ask for medical help, has been shifting towards a role of an empowered patient who very much wants to get engaged with their care because it's about their lives too. So of course they want to take part in that. Even the toolset has been changing. Physicians have been using analog tools and asking questions to patients, and their role has been translating all that information into actionable steps, diagnosis, monitoring, and all these. That toolset is vastly different today. It's about genomic tools, high-level analytical devices, artificial narrow intelligence, advanced digital health technologies, ECGs, smartphone devices, and they have to have a knowledge about using all these to be able to create those actionable steps and plans for their patients. If you better understand these roles, you can also come up with better pictures about which technologies might become accessible soon. If a startup can come up with an idea or the technology itself to 3D print medications, what do pharma companies and pharmacies do about that? What if patients can start printing out medications in customized dosages at home? Of course, they can do that today, but the technology exists, and we've seen studies showing that how useful it can be to provide customized dosages of medications, even customized shapes and colors for maybe kids who don't want to take their medications, but in a red octopus shape, they would love to take that medication. So we see the evidence-based background being built behind these technologies, but you need to have a clear understanding of a range of advanced technologies to find out which ones could be useful in your own businesses. One more global approach about digital health. Digital health technologies make healthcare globalized. You have to keep that in mind. The supply chains the supply chains change behind that idea too. Idealistically or theoretically, I could submit a cancerous tissue from Hungary to a Belgian startup. They could sequence the DNA of that cancerous tissue. They could look for driver mutations in clinical trials on a US Amazon cloud. And there might be a Swedish pharma company doing a clinical trial in South America, and I could get the most precision medical treatment for my own cancerous tissue through a global supply chain by not even meeting anyone in my own country's healthcare system. I'm not saying that's ideal, I'm just saying that digital health technologies make healthcare globalized. One more thing here about how the big picture changes behind pharma and pharmacies because of advanced technologies. The most exciting packages now for pharma companies are not just medications themselves, no matter how innovative they are, but a package of a medication and a digital health app device service. In Germany, one healthcare provider started paying more for one of these packages because when they give the medication to a patient with the digital health application, compliance will be higher. Of course, because they can use data, they can measure their own insights about their lifestyle and disease management to make better decisions about themselves. Of course, they get more engaged through that process. So the jackpot combination today is a medication with a digital health technology. And that's even more exciting and attractive for healthcare providers and payers. As I mentioned before, we at the Medical Futurist Institute did analysis about the futuristic scenarios of pharmacies. And as usual, we came up with three: a fairy tale, a quite optimistic and a quite pessimistic scenario. The pessimistic one was more about pharmacies becoming like health kiosks, where patients could go in, measure a few vital signs, and even by using telemedical services, discuss their issues with someone from afar. But there have been many companies developing these kiosks, and most of them have failed. So fortunately, this idea is not on the table anymore. The second scenario was more about pharmacies becoming parts of the healthcare ecosystem, meaning that if as a patient I go into a pharmacy, I could use the technologies being at the pharmacy to measure vital signs, health parameters, but more importantly, I could use the knowledge and expertise of pharmacists to help interpret my data. I think pharmacists are the most underused resources in healthcare. With their expertise and knowledge, it would be absolutely possible to help patients deal with the jungle of information they can measure about themselves. And even time is an issue here. I mentioned before that 1/3 of patients turn away from us because the physicians have no time for them, not enough time for them. Pharmacists could jump into that picture and give the chance to patients to better understand their data even before they go to a healthcare professional the next doctor-patient visit. And the third idea, the third scenario we had, the fairy tale one, was about pharmacies becoming health centers essentially. By reaching out to really advanced technologies, being able to 3D print medications in customized dosages at the point of care, at the pharmacy, after making sure that the patients can bring in their genomic reports with details about which medications they might be sensitive for or sensitive to, which means the customized dosages could be around medications which would work with those patients. So patients could use their personal molecular genetic makeup and get the right amount of help at their pharmacy. In many pharmacies already, there are robotic systems. So the medication packages are being selected by a robotic system in the background, and it's amazing. I don't want to imply with the image that humanoid robots will start working in pharmacies, but I wanted to imply the idea that it will be impossible to run pharmacies without the use of advanced technologies, including robotics. But maybe the one that will have the biggest impact on pharma from drug design to drug repurposing to the future of pharmacies is, of course, artificial intelligence. When there are data-based repetitive tasks in your job, it means those tasks could and maybe should be automated. When we look at artificial intelligence in general, we have to say out loud that today what we have is artificial narrow intelligence, meaning we have algorithms that can do very well-defined single tasks. They can run a self-driving car, they can play chess or Go, or they can analyze the data you have about your pharmacy and maybe organize a supply chain even better. But they have no cognitive power here. They can do what you can do. If that's possible, it means we have artificial general intelligence, the second level of AI that's, I think, decades away from what we have today. But in that case, an AI could have your cognitive capacity. I'm not threatening you, I'm just saying that eventually we will get there, but for decades we will only have artificial narrow intelligence. And again, if there are repetitive database components of your job or of your business, I think it's time to actively look for what automation, artificial intelligence-based methods could help you out in running your business better or doing your job more appropriately. But summarizing this second point about how you can allow good technologies to augment what you do, I just want to make sure you don't get the picture from me that we as a medical futurist want to get even more technologies in the doctor-patient relationship. No, that's the opposite. We want to remove every interface and leaving two people to have a real-life conversation, building trust, a relationship based on empathy and compassion. But in the meantime, I think they should be surrounded by advanced, seamless, invisible technologies, telemedical services, 3D printing, artificial intelligence-based analytical services, chatbots in the cloud, wearable devices, portable diagnostic devices, anything that can bring them data, provide them with data that could lead to better medical decisions in an eco-level partnership. That's the vision we think we have to have in mind or keep in mind while trying to find out which technologies to reach out to. So if you're a pharmacy owner, if you work in a pharma business and you want to make sure that you only reach out to those technologies that have a future, well, there is one line I will keep in mind. If that technology improves the doctor-patient relationship, or in this case, the healthcare professional-patient relationship, that technology must be on the right track. And that's why the third point I tried to raise to you is about the consumer from the near future. You can't essentially forecast the future of your business without understanding that consumer quite well. And well, here I am. I am the consumer from the near future. I live like a patient from the near future. I want to prevent things from happening, so you can sell me things that help me prevent things from happening or catching them as early as possible. But as a consumer or patient, I can do so many things with the range of digital health services I have at my disposal. I can track my fitness activity and motivate myself for even more fitness activities. I can track my sleep quality and use a smart sleep alarm. I tried measuring meditation or stress, but that didn't turned out to be that successful. I had my genome sequenced, so I learned what kind of medications I have a sensitivity for. So let's not take those medications that lead to hospitalizations unnecessarily. I know what kind of medical conditions I have a risk for. So with my primary care physician, we can design a preventive plan that might give me a chance for a longer and healthier life. Just might. I even had my microbiome sequence, so I learned what kind of diet I should have based on my bacteria living in my digestive system. And I'm extremely lucky to have a partner physician helping me in all this. But imagine that this partner could be at the pharmacy too. We could build relationships with people at pharmacies. They have the expertise to help us out, to guide us through this jungle of digital and health information. But for that, we have to really clearly understand what kind of needs this consumer patient from the near future has. Summing everything up, I think that's why digital health is indeed a cultural transformation. That's why COVID-19 has led to a faster technological adoption of amazing, exciting things and services in healthcare. That's why telemedicine is the new norm. That's why you have to keep an eye on technology giants and finding ways to collaborate with them, because they very much know how to make products that people want to use, technological ones, of course. And maybe that's why we have to keep on asking ourselves the what if question. As you can see, it's practically impossible to now, for anyone else than yourself, to tell you what's going to happen to your business, to your company, to your organization. It's going to be you. And the more you play with the what if question, the clearer image you will have about the near future, and the more prepared you will be for many scenarios and situations. The what if question is a method you can use every day to make sure that you find out which technologies might lead to nightmare scenarios that we must avoid at all costs, and which technologies might lead to a simply better healthcare professional-patient relationship. So by playing with the what if question, you gradually prepare for the future. Thank you so much for your kind attention and patience. And now I'm very much looking forward to the live Q&A. I know I have been poking you in some ways with these ideas and visions, but now it's your chance to poke me back so we can have quite a great discussion. Thank you so much for having me, and see you soon.
Uau!
Futuro é isso, né, gente? É para a gente se inspirar, para que a gente possa nos provocar e pensar nos nossos negócios, pensar no futuro. Esse é o Dr. Bertalan Mesko, que já está ao vivo com a gente, direto da Hungria. e vai estar conosco aqui numa sessão de Q&A. Mandem perguntas pelo chat, a gente vai começar aqui do estúdio com algumas perguntas, eu e o Alberto. Então vamos começar chamando ele aqui no telão. Hi, Dr. Mesko.
Olá, como vai? Muito obrigada por me receber. Bom, em primeiro lugar, parabéns pela sua apresentação brilhante, muito inspiradora para todos nós aqui no Brasil. Nós temos uma plateia aqui de quase 10 mil pessoas olhando ou assistindo a sua palestra ao vivo. A gente amou a sua palestra, muito, muito inspiradora. Agora estamos aqui ao vivo para as perguntas e respostas. A primeira pergunta que nós temos, você mencionou, e isso é uma discussão que nós estamos tendo aqui no Brasil, que as drogarias, na verdade, são parte do futuro do ecossistema da saúde e também que não estão sendo utilizados da forma correta, poderiam ser usados mais, de uma forma mais potencial. Minha pergunta é a seguinte, você vê isso acontecer em algum país do mundo? Isso está ocorrendo já em algum país na Europa, na Ásia, que nós poderíamos ter, por exemplo, como um caso, um estudo de caso para estudar e discutir isso aqui no Brasil. Isso é o que nós estamos, de fato, discutindo aqui para um futuro próximo. Essa é uma pergunta excelente e muito justa. Bom, eu já vi muitos exemplos ao redor do mundo de drogarias locais, mas eu não posso falar para você que um país específico onde você poderia seguir essa tendência. Para mim, não depende do país. Essa transição, ela só acontece se há pessoas que querem fazer com que isso aconteça, que querem conectar com essas tecnologias que podem ajudar a construir o relacionamento com o consumidor, que querem fazer experiências com ensaio e erro para descobrir se essas tecnologias vão contribuir para aquilo que estão fazendo. Então, eu digo para vocês, isso depende da vontade individual de mudar, e não o país ou o sistema de saúde público que seja pronto para implementar essas mudanças. Perfeito, Dr. Mesko, parabéns por sua apresentação, com muitos insights, foi brilhante. E a minha pergunta vai ser sobre os ecossistemas de saúde. A gente tem visto em várias indústrias diferentes os ecossistemas de negócios realmente fazendo uma disrupção do value chain, da cadeia de valor. Isso acontece no varejo, nos serviços financeiros, e pode também estar acontecendo em breve nos cuidados com a saúde, nesse negócio, né? Nós vimos isso acontecer na China, liderada pelas grandes empresas de tecnologia, empresas como Alibaba, Tencent, através do Ali Health, o WeDoctor. Esses negócios, a Amazon tem como objetivo fazer isso, estão entrando nesses negócios de drogarias, cuidados com a saúde, e talvez eles estejam fazendo uma integração e integrar uma solução ponta a ponta. Então, na sua perspectiva, quem você enxerga como os principais players liderando essa disrupção e transformação nos negócios de cuidados com a saúde, tomando a posição de ser um ecossistema único, tentando integrar toda essa cadeia de valor? Muito obrigada por essa pergunta. Eu acho que todo gigante de tecnologia, toda empresa de tecnologia está tentando construir em cima das melhores características, aquilo que eles fazem bem. Eu estou dizendo isso porque eu não vejo uma empresa sendo o maior concorrente das empresas farmacêuticas. Cada gigante tem uma coisa para focar. A Amazon é incrível com o supply chain, então claro que eles querem usar esse supply chain para repensar como operar virtualmente, ou, por exemplo, serviços telemáticos para os funcionários nos Estados Unidos. A IBM faz sistemas de tomadas de decisão baseados na inteligência artificial, eles estão muito avançados na computação quântica, e tem outras empresas que realmente trabalham a longo prazo, eles têm perfis eletrônicos. Se você olhar o Google, por exemplo, em geral, claro que eles têm também muitos produtos, mas eu acho que o que eles fazem melhor é melhorar e trabalhar o machine learning e o aprendizado profundo de aplicações médicas. Veja o DeepMind e o que a empresa tem feito no Reino Unido nos últimos anos. A Apple também faz muito bem produtos baseados nos consumidores que as pessoas querem usar a longo prazo. Então, eles focam no Apple Watch e usam isso em estudos médicos. Como você pode ver, cada empresa tem as suas características, os seus pontos focais. E dessa forma, eu não vejo que eles vão ser os maiores concorrentes, mas o que eu vejo são parcerias, colaborações entre essas empresas com o conhecimento que eles têm nessas áreas e esses gigantes de tecnologia usando o que eles têm de melhor e construindo coisas que as pessoas realmente querem utilizar. Perfeito. Bom, agora eu vou fazer mais 2 perguntas, são perguntas da plateia, eu vou fazer as perguntas juntas, porque as perguntas têm a ver uma com a outra. A primeira é de César Bentin, ele pergunta, bom, mudanças culturais parecem críticas em toda essa jornada, como é que nós podemos ganhar essa jornada? E a segunda pergunta vem de Eduardo Lesalski, na sua opinião, quais capacitações e qual o conhecimento que nós precisamos ter para os nossos funcionários nesse negócio? Então, são 2 perguntas interligadas, 2 perguntas incríveis. A primeira é uma pergunta excelente, porque a única forma de facilitar a transformação cultural é ajudar as pessoas que estão trabalhando nesse sistema para se prepararem emocionalmente para aquilo que vem no futuro. Pode soar ridículo, mas a melhor coisa que nós podemos fazer, nós que trabalhamos para facilitar essa transformação cultural é falar sobre o assunto, falar sobre os sentimentos, quando a gente usa novas tecnologias, como é que você se sente quando o seu funcionário ou a organização faz com que você use uma nova tecnologia, por exemplo? Que tipo de sentimento você tem quando uma inovação tecnológica, por exemplo, que você adoraria usar na empresa, na sua prática, mas você não pode usar porque talvez a parte da regulamentação ainda não está pronto. Você pode até mudar isso, mas os sentimentos, as emoções que as pessoas têm em relação a essas mudanças e esses avanços tecnológicos, eu acho que isso nos dá uma maior chance de fazer essa transformação cultural. Quanto às capacitações, as habilidades que as pessoas têm, eu acho que a amplitude que as pessoas precisam ter é bem semelhante às capacitações que os profissionais médicos precisam. Eu estou falando sobre a parte digital, o conhecimento de saber lidar com tecnologias avançadas, entender, digerir as informações, usar os canais digitais das maneiras mais apropriadas, ou seja, ser alfabetizado, por assim dizer, digitalmente, e depois capacitações humanas para entender o que os consumidores estão passando. Todas as empresas fazem produtos para consumidores, não é? Se você não entende o que essas pessoas passam enquanto estão usando esses produtos, precisam entender como melhorar esses serviços e esses produtos. E o que eu mais gosto é a previsão. Por exemplo, eventos incríveis como esse, onde você pode ter pessoas futuristas, e esse é o meu trabalho, para poder ajudar a prever o que vai acontecer. E ninguém consegue fazer melhor do que vocês. Então, eu acho que todos nós precisamos ser um pouco futuristas, prever o futuro e aprender a ler o futuro, aprender a fazer isso entrando, por exemplo, em comunidades online. Eu participo do projeto Good Judgment, é um projeto, uma comunidade grátis, são de pessoas que querem aprender. A gente recebe perguntas sobre eventos geopolíticos, esportivos, eventos tecnológicos, e o teu trabalho é fazer uma previsão desses eventos. Mesmo que você não saiba nada sobre esse evento, você pode aprender a capacidade de prever o futuro e de ter uma visão. Chama Good Judgment Project. E eu acho que pode ajudar a todos nós prevermos esses eventos de uma forma melhor. Você compartilhou um insight muito poderoso quando você falou de abraçar o design dos pacientes, uma ideia muito poderosa. No varejo, geralmente a gente fala muito sobre a centricidade dos clientes, a gente fala sobre a experiência do usuário, do cliente no mundo online, offline, nas lojas, nas plataformas digitais, nos diferentes canais. Qual a sua perspectiva? O que você poderia dar de sugestão para os varejistas para realmente repensar o futuro da experiência, abraçando o design, colocando o paciente no centro de toda a experiência? Essa é uma pergunta que vem do Renato Porto. Muito bem. Muito obrigada pela pergunta. Eu acho que, como eu falei na minha palestra, centrar no paciente é crucial, é muito importante, e o design é muito importante. Eu acho que a melhor diferença que eu posso fazer, distinção entre os dois termos seria que centrar no paciente é uma coisa passiva, você manda enquetes sobre o que o paciente quer ver no seu produto, eles devolvem as respostas, aí você vai decidir se você vai usar essas respostas ou ignorar tudo. É uma coisa passiva para os pacientes, mas no patient design, os pacientes vão participar ativamente no processo. Por exemplo, eles vão ter a chance de dizer, bom, isso aqui não é bom o suficiente, não vamos fazer. E no nível C da organização da sua empresa, eles podem ter as suas vozes ouvidas. Eu acho que parece um cenário difícil, porque às vezes você não consegue se comunicar com os pacientes, mas a ideia do patient design, o que essa ideia quer representar para a comunidade, é que há muitos produtos, muitos processos, talvez protocolos dentro de uma organização que poderiam ser melhor moldados por uma abordagem de co-design, e a melhor forma de fazer isso é fazer experiências. É isso que o hospital holandês fez, e eu fiquei impressionado, e eles também ficaram impressionados com os resultados. É uma coisa proativa, pode parecer assustador, mas você precisa fazer a experiência, ver em ação, ver como isso é útil, como os insights dos pacientes podem ser compartilhados quando eles são encorajados a serem proativos em todo o processo. Agora vamos falar sobre 5G. Alguns especialistas dizem que o 5G pode ser uma mudança no futuro da tecnologia, da mesma forma que a internet foi 20, 25 anos atrás. A gente sabe que através do 5G a gente conecta pessoas, coisas, isso poderia mudar o ecossistema de saúde, pode mudar essa parte de centrar no paciente, pode mudar tudo que a gente discutiu. Qual é a sua perspectiva nas mudanças 5G em todo esse ecossistema de saúde? Eu acho que qualquer inovação tecnológica, avanços que permite que os clientes recebam e compartilhem dados de uma forma mais eficiente, e todo esse compartilhamento mais eficiente de dados é um passo adiante para todo esse ecossistema, mas eu não acho que a gente usa até ao máximo o 4G, a gente não usa todo o potencial do 4G, ou seja, podemos desenvolver tecnologias que explorem melhor o poder do 4G e do 5G nos próximos anos, mas há tantas pessoas no sistema que não têm interesse de usar essa tecnologia, não sentem a necessidade de estabelecer serviços telemédicos. Aí sim, esse serviço seria relevante. Nós não temos profissionais suficientes que sentem a necessidade de fazer o design de protocolos para fazer operações ou cirurgias remotamente. Isso só é possível através do 5G. Você não pode parar uma cirurgia que é robotizada porque a conexão não deu certo, só com 5G mesmo. Então, a minha preocupação é mesmo se a gente tiver o 5G implementado em países e o 6G daqui a alguns anos, se as pessoas no sistema ainda têm medo do desconhecido, se não compartilham suas emoções, seus feelings sobre o uso dessa tecnologia avançada, mesmo se essa adoção estaria na frente da gente, a transformação cultural ainda estaria lá atrás. Então, quando a gente fala sobre a utilização dessas tecnologias em ação, eu só vejo que há uma oportunidade para progredir na cabeça das pessoas e como nós abordamos a utilização dessas tecnologias e a utilização do 5G. Bom, a sua resposta tem muito a ver com aquilo que você falou na sua apresentação, que parece que a evolução da nossa saúde, dos ecossistemas, depende mais da evolução cultural e das pessoas do que a evolução, por exemplo, do 5G. Exatamente, perfeito. Temos agora uma outra pergunta da plateia. Renato Porto, ele fala sobre o seu comentário da evolução do relacionamento paciente-consumidor. Você poderia compartilhar um pouco mais da sua previsão? Como você vê que esse consumidor-paciente, esse tópico, como que vai evoluir esse relacionamento? É uma pergunta muito difícil, porque eu não vejo mais diferença. A gente precisa entender melhor o que os consumidores querem, que tipo de desafios eles têm quando eles usam essas tecnologias. E, embora seja possível melhor entender, a gente analisa esses consumidores no futuro, mas eu acho que seria muito melhor se tornar um consumidor. Então, mesmo se você não tiver nenhum problema médico hoje, baseado nas estatísticas, você vai ter no futuro. Não estou ameaçando, são os dados, né? Mas se tornando um membro já antes de um diagnóstico ou um tratamento para monitorar, assim você pode começar a descobrir quais são os desafios que os consumidores podem ter, simplesmente tendo curiosidade sobre os insights da sua saúde, o que você pode aprender sobre o seu background genético, o seu estilo de vida, restrições e mudanças baseados em tecnologias. É um processo fascinante. E simplesmente sendo curioso sobre a sua saúde, você pode aprender muito através dessas tecnologias. E o que você ganha nesse processo é que você começa a entender os consumidores do futuro de uma forma melhor. Perfeito. Qual seria o seu último insight para nós, a sua perspectiva do futuro para a nossa plateia hoje? Eu não quero ser muito romântico, nem muito emocional, mas é claro ver que o Covid-19 impactou a vida de todos nós, a nossa saúde mental, como nós trabalhamos, como nós educamos as crianças, como que a gente entrega cuidados com a saúde. Tudo isso mudou bastante. A última mensagem é sobre esperança. Ainda há motivos para termos esperança. Depois que a pandemia passar, quando o novo normal, que pode ser diferente, e agora nós temos a oportunidade de construir um novo normal em 2 ou 3 meses, poucos anos, e essa oportunidade é uma oportunidade histórica para implementarmos mudanças que a gente nem previu antes, mas que podem impactar como a gente faz o nosso trabalho, como cuidamos dos pacientes, com benefícios para todos os lados. Então, vamos manter a esperança acesa e vamos manter a ideia na cabeça que agora temos a chance de construir alguma coisa incrível. Eu acho que isso é uma oportunidade histórica da parte da Abrafarma, de nós aqui. Muito obrigada pelas sua boa vontade de ter essa conversa conosco, responder as perguntas, e eu espero que em breve nós possamos te conhecer pessoalmente, ou te encontrar pessoalmente, talvez aqui em São Paulo, né? Muito obrigada por me receber, tenha um excelente dia.
Muito bom ter essa combinação, né, de discussões e apresentações que olham para o presente, algumas que olham para o futuro, algumas que saem um pouquinho do dia a dia para nos ajudar a pensar em transformações um pouco mais estruturais e complexas, e E o nosso papel aqui é tentar depois conectar essas coisas para deixar algumas mensagens e insights que possam ajudar as empresas a transformar os seus negócios.